you have shared like really important health tips. So
Yeah.
for all the women and girls out there, this episode is, consider it as a treasure trove for you, because Dr. Puri has actually shared everything starting from your intake to your exercise, and then he has shared those formulas, those simple formulas which all of us can do in order to check either we are on the right track when it comes to heart health or not. So, Dr. Puri,
There are many more
talking about,
things I would like to
yeah,
add.
sure, sure.
So I'm not done with the preventive measures. So
Yeah, yeah,
another
please
thing
carry on.
is that women who smoke, the risk
Hmm.
of having heart attack is much more, and
Hmm.
risk of having cancers is also more. Breast cancer risk also increases a
Hmm.
lot in
Yes.
smokers. So women should not smoke, and when we are
Hmm.
smoking, we exhale the bad air out, and other people who are non-smokers, they inhale it. So you are increasing the risk of people in your surrounding also. So
Surrounding it.
smoking is usually nowadays banned in public places. So is it
Yes.
banned in Pakistan?
In public places?
Yeah, smoking.
Uh, no, not in public places. In restaurants, yes.
Yeah.
When we are saying public places, in open parks, it's not, but in restaurants, yes, it's banned. In cinemas, it's banned. All indoor places, those are
Indoor.
public.
Okay.
It's banned. And in government territory, for example, if we are visiting the historical places, or
Okay.
any place which is under the territory of a government in terms of the management, yes, it is banned, and in all
So,
educational institutions, and when it comes to offices, inside the office. But when you have to go outside, people do smoke.
okay. So, like in
Yeah.
railway station, bus stops, is it banned
Not yet.
in the markets?
Not yet.
So, I think you should emphasize that because women, they may not be smoking, but they are inhaling the smoke which the other people are exhaling. So we
Right.
should emphasize this. And regarding alcohol, like the limit, usually the guidelines say that those who don't take alcohol, there is no indication to start taking. Like some people say that it is good for the heart and wine should be taken. So
Mhm.
it's actually a myth because
Okay.
there's no medical indication to start drinking to take care of your heart. But those who
Okay.
take alcohol, the
Hmm.
limit for women is much lower. Like they should not take more than one drink in a day. So
Okay.
some people, they don't drink for a month, and then one day they take like 8 10 drinks, which is called binge drinking, and that is bad for the health. So it will harm your liver also, and it is bad. It can cause heart failure also. It can cause arrhythmia also, especially in the winters. So many people, they take a drink that they think that it will give them protection during winters, but then when you drink, it can dilate your arteries, and it
Yes.
can cause like some cardiac complications also.
All
So
right.
drinking also, those who drink, they should take in moderation only. For women, the tolerable level is half of that of men. And
Okay. Okay.
other things like vitamin D exposure. So many
Hmm.
women nowadays, if they are working and doing household work, their exposure to sunlight is very less. So
Hmm.
now,
True.
like previously, people used to think that vitamin D is required only for the bones. But
Hmm.
nowadays, there is enough evidence which suggests that if your vitamin D levels are low, then the chances of getting heart attack are more. And it is seen that the precursor of vitamin D is squalene. So when you are exposed to sunlight, it gets converted into vitamin D. But when you are not exposed to sunlight, it gets converted into cholesterol. So if you're not exposed to sunlight, your cholesterol levels will increase, and your protection against heart attack will decrease. So the
Okay.
chances of getting a fatal heart attack is more if you are having vitamin D deficiency. So every woman should check their vitamin D levels and correct
Okay.
it, because otherwise the chances of osteoporosis are also more, and the bone getting fractured by small
Hmm.
injuries is more, and also the chances of heart attack is also more.
Okay.
Apart from
That's
that, stress is nowadays becoming very important, many people, they are not able to have stable relationships nowadays. Relationships are becoming more fragile, so more and more evidence is coming. And especially it is seen that almost one third of youngsters, they are having significant stress. It may be related to their studies, maybe to their careers, it may be financial, it may be because of the bad relationships. So it is very important to maintain healthy relation with your family, with your friends, with your colleagues, with your seniors. So those people who are not able to maintain healthy relationships, they are more prone to get heart attacks and stroke and diabetes and hypertension and other lifestyle diseases like cancers. So this is also very important.
So yes, I was actually about to ask it, but you have highlighted it like very well about the importance of this mental and emotional well-being, that we really need to look after this as well, because along with the physical aspect which is linked to heart health prioritization, we really need to, as Dr. Saab has said, that we need to keep a focus on how mentally stable we are or what we are up to in terms of our priorities or relationships. So it was really, really insightful, Dr. Puri. You have actually cleared couple of misunderstandings and myth which was regarding heart health. And specifically, I just got to know because you mentioned that D3, vitamin D3 is something people link it to bone health. And yes, I was also of the same opinion. But now you have actually educated us that no, it has a lot to do with your heart health as well. And I'm sure for all the girls and women out there, you really need to actually, what you can do is that you can actually take the notes of Dr. Puri's different aspects that he has shared, because he has elaborated in a way that I'm sure even if you're going to go to a hospital, none of the doctor is going to tell you in this much detail that you have to do this. And we are grateful to you, Dr. Puri, that this is, that's why I've said that this episode is a treasure trove. I would rather call it as a treasure trove of heart health and information.